Misconception I hear from patients is I want some Dysport or Botox up here to give me a brow lift. Brows are nuanced when it comes to treating them with a neuromodulator. So let's look at the mannequin here and talk about the muscles first, and then we'll talk about where you can get the drug placed to give you a brow lift. The frontalis muscle, or the forehead muscle, is the only brow elevator. It's the only muscle that pulls your eyebrows up. In contrast, there are a few brow depressors, or muscle that pull the brows down. Orbicularis oculi muscle, or your crow's feet muscle. The muscles in your glabellar region. Between the eyebrows, you've got the procerus that runs vertically, and you've got little corrugator muscles here that are running kind of like this. The muscles here and here pull your eyebrow down, and your forehead muscle pulls the eyebrows up. So if a patient comes to me and says, I don't care about anything else, I want a maximum brow lift, I treat only the depressor muscles, and those muscles are no longer able to pull the brows down. So you treat this muscle, and this muscle, and you leave the forehead alone. The result of decreasing movement or prohibiting movement of the depressors and leaving the only elevator alone results in a significant brow lift. Most women, however, want their forehead treated. It's honestly one of the most common areas people come in for the first time and want Botox or Dysport for. Whenever a patient comes to me and says, I want my forehead smooth and I want a brow lift, I always talk to them about kind of the yin and the yang of the elevators and the depressors. Patients who have really heavy brows, kind of low eyebrows, or lots of skin up here, it's really hard for me to get your forehead totally smooth if you also want a brow lift. Remember, every action has an equal and opposite reaction. And so if we treat your forehead too heavily and we don't treat these depressor muscles as evenly, you can actually get a slight brow drop, which no one really wants.